Right, I think we're ready. I hope you've all enjoyed the program and the lunch offered by our hosts. We should like to thank very much the AmCham for the invitation. To discuss a subject and we have a rather balanced panel. We have a bit of everything and we have the best. When we had the Greek NHS in 1983, 1984, I was very young back then, and I was a member of the committee that had to do with the organizations of the hospitals and the inclusion of the hospitals in the then newly established NHS. And after 40-something years, we're here again, Kyriakos. I was very young back then. I'm no longer now, you know. So as I said before, now we have the de jure responsible party, the minister, and we would like you to open the discussion. The floor is yours. I don't know whether you want to go to the podium or stay here and to see where we are. Because the title needs a bit of an explanation, what we mean by inclusion of a hospital, of a new hospital, and what we mean secretly of what is a new hospital. Because, well, you see, hospitals and the way of their organization and even their building and everything and architecture is entirely different to what it was back then, because technology changes, the needs change. So, Minister, you have the floor. Yes, I would also like to thank the AmCham for the invitation. I would like to say that I am in an exceptional panel. It's one of the very few times that even if I were setting it up, I wouldn't make it better. They're all excellent colleagues, each in their own field of expertise. It's what we call professionals. They're all professionals. I'm very happy to be part of it. I would also like to set the title because it's a bit too general, and I would like to say what you said. Now we have a hospital that has infrastructure, there's a new infrastructure, but we also have a new hospital as regards the form and its way of structured operation, and how we can move from a system that for 40 years has been working in a very specific way, moving on to a new era, a new time, or a transitional stage to reach the level at which we want hospitals to be in the years to come. I will start from the building of new hospitals and say that hospitals in our country were built a number of years ago. The most recent one in Attiki was built 20 years ago. And due to the memoranda and the crisis we had, there were no serious reconstructions or renovations. This changes in the access with the addition of 3 new hospitals by the Stavros Niarchos Foundation, which creates the new hospitals in construction, but also some new innovations that will have to do with the administration and the way they operate. We have a new hospital in the Theagenion, which is already in the pipeline, and it will be the first PPP hospital in the country. No such hospital was ever built in the country before. And we're talking about another couple of hospitals that we either need to replace an old hospital or to create a new one. Primarily in Attiki is the other hospital, due to the accumulation of many hospitals we have in the main central axis. It's not the easiest exercise to make, the equation to solve, A new hospital needs several million to be created with the land ownership and the equipment and the modern in today's times. It is something like 300 or 400 million euros to create a new hospital. The most important thing is to move on to new forms, and I would like to come back to the discussion, to new forms of governance and administration. What changes in our hospitals, and it changes for the first time, is the reimbursement model. We're moving gradually into the DRGs. There's a lot of discussion to link the productiveness, or rather to link the funding of the hospitals with productiveness and the work they produce. This is rolling out just fine, really well. We already have the pilot phase over the past several months, and in all health districts and regions of the country the work has started, and the 2025 budget will be split and it will be distributed to the hospitals on the basis of the DRG. Let's focus on the Stavros Niarchos Foundation hospitals, which will be the beacon. They are legal persons under private law. In the system they work we have the Papageorgiou in Thessaloniki and the Onassis that work in this way, although they are in a range that they're all legal entities of the private sector, both of them. One of them is in the NHS, the Greek NHS, and the other is in more modern form. Now, both all hospitals in Sparti, Komotini, and the pediatric one in Thessaloniki will offer services to all citizens for free. But we have the innovation of the administrative director within the hospital, chartered accountants at the end of the year. The departments will not be broken down into clinics. We'll have the bed manager who will be able to distribute the beds within the hospital to deal with pathogenicities that we do today, but with great difference. And this is how the hospital will be administered and governed. We will have a special pathology and internist sector, and all clinics will share the beds. This is a big innovation. Going back to the building thing, these hospitals will be state-of-the-art in terms of environment footprint. They will be elite, and they will be the first ones to meet the requirements of building in an environmentally friendly way. I think this is a good introduction for us to move forward, isn't it?
Everything you said is very encouraging. And I hope that we will get the chance to answer to other questions during the discussion. And I would like to give the floor to Panos Papoulias, Chief Operating Officer, Stavros Niarchos Foundation, a foundation that I would personally like to thank for all the contribution it has made to the health sector. I would like to give you the floor so that you can share with us your view. And I would like to ask you, why did you build hospital in Sparta and not in Trikala? Example, okay, it's just a question. I mean, what were the criteria you used or you agreed on with the Ministry of Health? What were the criteria that you used? Part of the answer has to do with the values that govern the operation of the foundation. Values that are not directly linked with the health sector, but still are associated with the way we proceed with a process, be it a process for the donation to a health sector or to another sector. But first, I would like to thank the AmCham for the invitation, and I would truly like to say that it is an honor to be part of this panel and to represent Stavros Niarchos Foundation. Along with Mr. Themistocleous, we work on a daily basis under the initiative for the improvement of the health sector. With Mr. Souliotis, we have worked in the context of other projects that we ran in the past. The point is that Their contribution has been great to the health sector. It's an honor to be among them today. Mr. Boletis and Mr. Souliotis, it is a great honor to be with you today. I have prepared a very short presentation for today. And I would like to start by saying a few words about the foundation. And then I will make a very brief reference to the Stavros Niarchos Foundation, because parts of this project have to do with the building of hospitals. Then I will talk about the framework of donations to the health sector. And then I will say a few words about the way we selected the hospitals. And maybe in this way I will answer to your question. We always want to remember our founder, who established the foundation in 1996. One of the values that we believe in is that any donations we have are neutral in terms of politics or in any other sense. As you can see on the map, we have made several donations, many of which have taken place in the United States. There we have organizations with whom we collaborate in order to develop certain assumptions for the hospitals. As I said, the Stavros Niarchos Foundation is the biggest donation. The Stavros Niarchos has made the biggest donation for the building of the hospital. And we decided this donation on the basis of two principles. The first had to do with the building itself. We believe that the construction needs to be the right one and to be based on the right assumptions that will impact the operation later on. Here you can see the space where the Stavros Niarchos Foundation was built. Here you can see some other pictures, and these take me to the next point I would like to raise, a point that pertains to the cooperation with all the stakeholders, with all the community and with all the entities, be it the future users of the foundation or the doctors or the public sector or the state. All these may sound simple, but they require a lot of work and many sacrifices by those who work in the projects. In order for the Stavros Niarchos Foundation to be as it is today, our donations to health were not made in void. For 28 years, we based on other donations we had made. I mentioned some of these. We actually had the honor to have partners like Mr. Boletis, Mr. Gkikas, and others that allow us to learn from the previous donations and to be certain that we would approach such a large-scale project like the construction of 3 hospitals and to successfully complete the construction. Of course, the project with the ambulances was a big project, very difficult. Here you can see a pet city project. Now, the initiative for the donations to the health sector includes various different parts: airplanes, education and training programs, all of which require time and are not always publicized as much as we would like. There are a series of donations that together create something more holistic and a more comprehensive approach with regard to the provision of access to health. Here you can see a detailed presentation of all the donations. I'm showing all these very quickly, just so you can have an idea. The 3 hospitals, as we said, are the climax of this program, and they are located in the regions of Greece. And by regions, I don't mean something negative. I just mean that they are not located in big urban areas, and this actually will increase the access to the health sector for the people residing there. A half answer to your question, Mr. Dervenis, the first one being why not in Athens and in Sparta, before I answer why in Sparta, not in Trikala. The first answer is that after consultation with the public, we realized that these 3 projects should be made in the regions since there was an overconcentration of hospitals in Attica. Here is a time frame, and here you can see that at every different stage of decision-making process, there were some critical points where discussions were taking place or projects were completed. You can actually find this information on our site. Every month, a committee is convening, a committee that has been institutionalized by the public sector in order to approve decisions and to resolve problems. Of course, we don't wait to solve problems by meeting every month. No. We all together, all the stakeholders have a daily contact when this is necessary in order to resolve issues that may emerge during the implementation of the projects. However, this committee is institutionalized, and it is there that formal and official discussions are taking place and decisions are made. Such an example is the development of the Children's University Hospital in Salonika. Some point in the development of the project, we realized that this was being built as a general hospital, whereas we wanted it to be a children's university hospital. That is why then we contacted the Aristotelian University of Salonika. We changed the design of the hospital. We changed the assumptions of the organogram in collaboration with the public. We updated the different designs and plans, and this is how we have gotten to the present moment. This means that whenever we identify something that needs to be changed in the plan, we actually make the necessary changes that will be to the benefit of all stakeholders. Here you can see some extra services that were created on top of the initial planning for the university hospital. And here you can see the consolidation process with the doctors. They saw the equipment, they saw the plans, they made some changes. This was a painful but very important process for all those who were taking part in this project. Every 6 months, we have open meetings with the local community, apart from the ordinary meetings we have, during which we hear them what they have to say about the hospitals. The point is that after these discussions, we were making changes depending on the needs. And now to your question, why Sparta? Because Sparta, along with Komotini, are two of the oldest general hospitals that exist. In the open meetings that we had, we were hearing stories of horror, one would say, about the problems, the static problems that the hospitals were having. These are important areas. Everyone has a right to access, and the location of the hospital and the cooperation that it may have with other health units is of utmost importance. On the site of the foundation, you can find relevant information, and you can find a detailed report about the state of development of the project. And this is for transparency reasons. Thank you very much.
We would now like to move on to my good friend, Professor Boletis. Among other things, he is president of the board of the Onassis Cardiac Surgery Center. We used to say that we wished all hospitals to be like the Onassis Cardiac Surgery Center, both in terms of buildings, but also operationally, functionally. Please explain why we had such an admiration for it. Even back then, when we didn't know how it works, we had a feeling that it was something different, and we wanted all hospitals belonging to this classic model of the Greek NHS to look something like the Onassis Cardiac Surgery Center. How do you feel? How do you think this model can be implemented? Let's hope that everyone will say that all hospitals will be like the Stavros Niarchos Foundation hospitals. Now, I should like to wish everyone a good afternoon. I should like to thank the AmCham and for everyone to be here in a very fertile environment for dialogue. And like the minister said, it is an exceptional panel of interlocutors, and I want to thank Christos and Panos here for their kind words. Now, in my introduction, I should like to say that I worked with the Niarchos Foundation to not just do the refurbishment, the renovation of the transplantation unit and the nephrology unit of our hospital. From this thing alone, you will realize that I was trying to make this happen for 15 years, Minister. The only thing we managed to do in these 15 years was to have an approved plan, approved by the Ministry of Health, that did finance the initial hospital in part, and then the Ministry of Health. We couldn't move any further. It took us 15 years. Now, the foundation evaluated this in 3 months. Mr. Papoulias and his team, we finished it in 6 months. This is why we need to do something different, and this something different is done by the Onassis. It has been doing the Onassis Foundation since 1993 that we have the Onassis cardiac surgery, and will be the Onassian hospital for the next few months, because we have a transformation that transcends cardiology and thoracic surgery. And then I'm certain that such a course will be followed by the hospitals that are under the auspices, as it were, and the responsibility of the Stavros Niarchos Foundation. So why these hospitals? Now, first of all, many people see and recognize the building. There is no doubt that with the completion of the new building and the lighting of everyone by deco, to borrow something from the Stavros Niarchos, or to walk hand in hand with the most beautiful picture in the area, this makes it recognizable to the passers-by. I'm thinking of the Lycon Hospital, which I love very much, the huge difference between the two. Then we have the hospital part. In the, I don't remember how many anniversary of the Attikon Hospital celebration, I heard, and it still rings in my ears, that with 628 beds, it has 800 people of nursing staff. The Onassis, with 136 beds, has 400 people. And to add 57 additional beds, we hire another 200 nursing staff. Mr. Polisos and Mr. Souliotis know a lot of these things, because they have participated in positions and jobs of responsibility at the Onassis Cardiac Surgery Center from the onset. This makes a difference to the people who come there. Setting aside the whole other system of reception, sanitation, there is no exclusive nurse for the patients, and all the relatives have a specific schedule of visitations, with the exception of children, like the rest of the world, and then they leave. So I hope that the ministry, with the assistance of the Niarchos Foundation, will ensure and secure such a way of operation, because the buildings and the equipment will be magnificent, but what it takes is a modus operandi that will allow all these things to bear fruit. And to cut a long story short, the way is this legal entity under private law towards the liberal part of private law, rather than the state side of the private law. These things are over there. We can discuss them. The minister knows them better. They have been discussed already. So we're very lucky, we're very fortunate, because we're on the side that gives us liberties and freedoms to move. And these freedoms and liberties are not only pertaining to financial management and administration. I think it's very, very important. From my experience in the public sector and the university, it is the facility and the ease and the leeway in managing the human resources. You need to be able to manage them at all levels: remuneration, compensation, evaluation, assessment, and so on and so forth. For more details, I'm here at your disposal, and thank you very much. Thank you, Mr. Boletis. And let's move on to Mr. Gkikas, and I would like to thank him personally for being here today with everyone, his partners and the staff that's helped us. He is president of the Medical Devices and Diagnostics Companies Committee of the AmCham, and as I said in my introduction, we're talking about new hospitals here. And when we're talking about new hospitals, in the mind of most of us, buildings is what sticks out, but also technology. I mean, it's a different hospital of the previous 30 years and quite a different hospital of the 30 years to come. Because technology is what determines and defines everything. We would like to hear your view and your perspective, how you view this classic question of how we will include all this thing and how we will transform our hospitals so that if we integrate them, they will be integrated as hospitals of the future rather than the past.
I would like to say that this is an issue that I'm very interested in. I have spent a lot of years examining this issue of building a hospital. And as I was mentioned, there was a hospital that we built and in which I was personally involved for many years. So I understand this issue very, very well. However, I would like to leave aside the building aspect and to talk about the way that medical technology will be of assistance to us in this effort. What we are trying to do in the industry is to approach the equipment in terms of the clinical pathway. We want to see how the medical equipment can accompany the patient from the moment of diagnosis up to the follow-up. So we're not talking only about a series of devices, but how technology can actually assist and monitor the pathway of the patient. So very important part is for these buildings to be properly equipped with this type of technologies. Now we are talking about the time of Diagnostics, which is a combination of medicine and technology, basically. These are the expectations that we have for our new hospitals. The second part that has a lot of interest for me personally is this issue of hybrid nature that will prevail in hospitals. Technology is not taking place or used just in hospitals, but also in the house, but also in the primary healthcare. And the patient remains a patient of a unit. So we need to see how the new hospitals will adopt the practice of being able to monitor the patient even when they are not in the hospital, when they are in the house, for example, and use small devices like a smartphone. This is a completely different approach. And the third thing that was mentioned has to do with sustainability. Indeed, it is quite impressive. And by the way, I actually witnessed the construction of the foundation, Stavros Niarchos, and I saw that the environmental protection criteria and the environmental specifications were very, very strict and demanding. And, of course, this is also the case for medical equipment. But another thing is very interesting for me, something that has to do with sustainability in terms of productivity. In other words, how this technology will be productive inside the units so that we won't have any waste of resources, nor waiting times, or anything else that is negative. So sustainability has to do with the environment, with green development, but also with the utility and the productivity of the equipment, and obviously with the preparation of the staff that needs to be well trained and to be able to operate in workflows that will not be exhaustive for the staff. I believe we have a unique opportunity ahead of us because we will have wonderful structures, but at the same time, we will have an opportunity to provide the system that will ensure care for the patients. The technology will be of assistance to us. Since I'm mainly a clinical doctor, I'm delighted to hear these things from you. And allow me to make a small comment. It is obvious that new technology requires two things: a different way of management, and second, different type of people that will use the technology. In other words, what I mean is that I don't know whether we, the doctors, are ready to operate in such a system. In order to be ready, we need to involve universities so that we can have the necessary education and training. However, I keep this point for later. Kyriakos, it's a great pleasure to see you once again in a panel. Mr. Souliotis is a professor, as we all know, at the University of Peloponnese. He has written several chapters and publications. I was very happy to read that you are among the 100 leading scientists in your sector. Before I give the floor to the minister and ask a question, I would like to ask you something. You are very used with indexes, indicators, KPIs. And the question is rather rhetoric. Don't you think that we need to use some KPIs so that the integration that we talk about, because integration may mean, if you like, elimination of certain hospitals, doesn't mean that we need to integrate our hospitals. We may need to merge hospitals, or we may need to make other sort of changes before we start talking about the hospitals and their integration. I would like your view on that.
Right, thank you so very much for your kind words. I'm very happy to be at this table and the subject shows that we're ready to take a step forward. Truth be told, there are almost reflex reactions whenever we're talking about a change in the landscape. I can't explain it from a sociological point of view. The AOP reactions, DRGs, I can see Nikos Polisos there, and how difficult it was to introduce DRGs in a country where it's just a technical measure that's unavoidable. And it's a tool. We need to have efficiency in reimbursement. Things that should go without saying, we found it very difficult to implement. I don't know why, but we succeeded. The two prefectures we chose, I have a study that we're about to publish on hospital flows. The flows of patients when they're seeking healthcare. These two prefectures have the biggest degree of dependency from Sparti and Komotini. They have to travel to look for care. So why in these two? And why not else? Well, the pediatric hospital has a documentation in of itself. So we have the inclusion of 3 structures in our hospital map. In areas where we feel we have needs regarding Komotini, we have another wider strategic interest. We all understand what I'm talking about. But when you have new structures or an existing hospital map, one needs to create the pathway. The patient's journey cannot be unchaperoned. I mean, they can't just go and say, I heard there's a good doctor there, so I crossed half the country to meet Professor X that I found out that is very good, because there may be others who are better or equally better. In the 20 years of Attikon that my Mr. Boletis alluded to, I heard that Attikon has 110 coverage of their beds, and 55% of those patients come from other prefectures, so they are a victim of their own reputation. So we need to revisit the country's roadmap that changes the rules of the game. Now, moving from an area to another is an entirely different thing. So the patient's pathway in the system is different. Now, in a recent study with Diagnostics that we co-signed with my friend Mr. Polisos, we say that hospitals need to be interconnected. They can't be standalone. Each hospital is not a single unit in the hospital map. They need to be points of reference. First level of reference, it's the primary healthcare and the health centers, and the second is the hospital, etc., etc. And the pathway needs to lead you where your needs will be met. Now, I have this support of the Onassis cardiac surgery, and I know this, and I recognize it, and I support it, but in a sector that is constantly changing, where you need to have reflexes because crises will emerge, you can't try to find what will happen in the time of need. These models of the legal person of the private sector are the ones that will help us. I mean, how many times did we hear that the machine was off and the patients need to be referred to other structures because the maintenance SLA has some problems, we couldn't find the spare parts. These are everyday problems. These are resolved by a flexible decision-making system. And I'm very glad to see that these hospitals are built the right way. Legal persons under private law, not to lose and waste jobs. We need a positivism. Whenever we see private, we break out in hives. I really don't understand. I mean, the most expensive thing, which is drugs, is offered by 11,000 small businesses. We receive our prescription from the doctor. We receive it. The pharmacy is a private business, but the AOP is paying. So this is included in the public health system, and we need to view it as such. So the biggest flexibility we have in such a structure, the better results we will have. So yes, we need to measure. We need to perform an impact assessment as well. What is the coverage needs of those people there and here and do that? And I'd like to thank the Niarchos Foundation here for them. And what is the day after? Because we need to start measuring. And if the data say that we failed there, we need to be able to redesign. It's not a bad thing to say that I will merge two structures to build another one. a better example than the Argos Nafplios hospital is 12 minutes. We have two hospitals between Argos and hospital. We could have two. Quite possibly one hospital does one thing and the other does other, but to have two small clinics that do not operate optimally at 12 minutes apart is not good for the system and its viability and sustainability, or for the citizen. At some point, in the areas that technologically are of high risk, we need to put the private sector in the game and to say that you will operate this department, you will pay rent, so I, as the hospital of sound mind, and if you are productive, have a turnover, you bring people, you bring the best machines and everything, you modernize it, you will have your benefit. And I will offer citizens the best possible quality for the least possible risk. Because inherently and purely public sector, we don't have the flexibility to meet the equipments and everything. And while we're talking, there are new emerging health needs and there are new treatment responses. So how can you incorporate them all to the benefit of the society? Only with flexible systems. We shouldn't fear them. The Onassis Foundation, for as far as I know them, offers services to the citizens under security and coverage. Social security coverage, and they never changed. Thank you, Kyriakos. The funny thing is that in Greece we're against entities of public sector that are more public than the public ones. In the public sector hospitals we have a whole funfair and we have a whole fair, and we are offended by the flexible forms. Now, you've got a hot potato in your hands, right? That was not yours. It comes from way back, this opposition that contains this cursed word, private, that could be to the benefit of the public system. This is what's tragic. So, Minister, I asked Kyriakos the question earlier, but I would like to ask you, because you're more competent to answer. In our planning, are we focused on using other methods apart from the merger? I'm talking about closing down hospitals, transferring them or transferring their services, or departments of these hospitals that are not working. This is something I understand that needs to works in an atavistic way, and it causes reactions that we shouldn't in Greece as a reflex. But my question is, how feasible do you feel it is to restructure the entire hospital care map in Greece in order to be able to integrate and incorporate new hospitals with new technologies and new management? Experiences from the Onassis or the Papageorgiou in Thessaloniki, or even public entities under public law. But are we ready to make such a big move? Or are we going to fall flat on our faces?
But before I reply, I would like to make a parenthesis. The example of Onassis, because everyone gives this example and how good a hospital it is. The example of Onassis Hospital, and I believe Mr. Boletis would agree, and with exactly the same system, had a debt of 130 millions. And by changing the persons, the people, everything changed. To make things clear, what I mean is that it's not enough to find a system. No, it is not just a matter of the system. The people play a very important role. The Onassis, as it operates now, the same hospital that is now praised by all, 9 years ago had 130 millions of debt, far greater than the debt of not 1, 2, or 3, but of 15 public hospitals. So it is very important to have the right people. And it is equally important to have a monitoring and auditing mechanism. So before we proceed to anything, we need to make sure that we have the right people that are capable of running management systems that are flexible. And now we're talking about a new form of management. This was mentioned previously, again, by Professor Boletis. This new form of management means that there will be flexibility in the labor relations. Is the Greek society ready to talk about this type of flexibility in work relations? We need to add that to the equation, because management of public and private hospital is radically different. Okay, we cannot compare the two, but still, what we need to keep in mind that the private sector is actually performing smaller size operations, and it tries to maintain the quality of the services that it provides, something that the public sector cannot do very easily. So if we actually see what are the rules that govern the operation of hospitals, then we can actually come up with a roadmap that will help us proceed to the future. And to answer to your question, we are talking about a redesigning of the health map. This redesigning is based on various different stereotypes. Some of the stereotypes are of local nature. For example, people don't want the hospital to close down. They don't want to see the cardiologic clinic to close down. And then, on the other hand, there is the other stereotype, according to which something has to close down. You have 126 hospitals, whereas Portugal has 60. Yes, but Portugal doesn't have so many islands. In Greece, we have hospitals on islands that will continue to operate. They have a debt. They don't abide by any economic rule that is the rule in the private sector. The point is that they will continue to operate. And I will give you an example. There was a big private hospital that could not actually keep it operating. And this was in one of the basic islands of Greece, biggest island of Greece, Mykonos. It was a big dialysis hospital in Mykonos. And this hospital actually closed down. This private hospital couldn't find the doctor or couldn't pay the doctor so as to maintain the operation of the hospital. And this means that a large part of the public system will inevitably be non-profitable. And to add to that, I would like to say that there are going to be areas like Argos or Nafplio. There are not many in the countries, but they will soon emerge. For the first time, after 40 or 50 years, these areas will emerge and will have a very specific plan that will be implemented there. There are some interventions that are planned in local hospitals. Some other things that I would like to say is the claim of many people who wonder, can you possibly have one hospital in Livadia and one hospital 12 kilometers away? To build a new hospital, you need 10 years. Apart from the funding, which is a very important aspect, building a hospital is not an easy task. The fact is that the country will have a plan for the distribution of departments and the classification of departments. A plan that has taken into account legal challenges that pertain to the secondment or to the transfer of one staff of a hospital to another. And there are going to be also provisions that will apply horizontally in hospitals. These are provisions that exist in other countries. Countries that, of course, have a different history with regard to the hospitals. I'm talking about the northern countries, but still we will be daring enough and try and put these plans into practice. And that's not just because we need to make a reform or because we need to make a change, but because at the end of the day, and this was mentioned by the previous speakers, will be to the benefit of the patient and to the benefit of all citizens. And having said that, I would like to talk about the culture of data collection. What we need to do is to check the performance of a department. For example, we need to set a number for medical acts, and on the basis of the acts performed, we will decide on whether the department will close or not. This will be for the betterment of the quality of services we provide. We need to make sure that the citizens will enjoy medical and nursing services wherever they go and whenever they go that will be safe. I wish this will happen. I wish. I only wish. Seeing is believing, as they say. Thank you very much. Mr. Papoulias, what's next? What's next? What could we expect from Stavros Niarchos Foundation? In the health sector, of course.
Right now, we're focused on implementing the International Initiative on Health. It's not just 3 projects, the hospitals, it's a lot more, but the conjuncture of the creation and construction of these hospitals has been difficult as of late. There were inflation pressures, there was a war in Ukraine, there was a COVID crisis that created problems in the completion of that. And as you saw, the planning phase is complete and we're now on track regarding the building of the hospitals. So for the next time to the hospitals, yes, for the next time to come, we will try to utilize and organize all the stakeholders, the Greeks and the others, focusing on the harmonious coexistence with other health care professionals in the country. And we hope, or rather we're convinced, that in 2.5 years from now we'll be able to talk about the delivery of hospitals that will be perfectly built, that will be required by these societies. And the management of other hospitals, not to manage a plethora of cases that are unnecessary. And particularly for the University Pediatrics Hospital in Thessaloniki, we aspire for it to be a landmark of a different type of treatment, healthcare treatment, not just medicine, but as a culture of treatment and services for the patients and their families. Thank you very much. A very brief question for all 3, so as not to waste time, the last 3 speakers. Based on your experience, each from what you govern and what you serve, if Mr. Themistocleous were to ask you, in relation to hospitals, to give him his advice, what would be your advice to him? What should be the first move he should make to have a more effective plexus and nexus of hospital services in the country? Ioannis. Now, the management and administration of each hospital, because I have the honor and the responsibility of being for 5 years with the Onassis Cardiac Surgery Center, I didn't want to raise. Mr. Themistocleous is right. And I would like to add something more. When he gives you degrees of freedom and the management is not professional, I'm not talking in terms of church morality. Things are even worse because no public hospital has 130 million debt. So it's a different way that things are settled. But the Onassis had that. So it needs a framework and it needs professionalism, but it needs constant assessment and evaluation and fail-safes. The memoranda did bring some such mechanisms, but they can be circumvented if one wants to. They can be worked around. So mechanisms, constant evaluation and assessment, professionalism and meritocracy, but within a framework. No matter how good you are as an administration, unless you have a framework, things can't work. Now, what I would like to tell the Minister is I don't know how difficult it is for the central IPE, 2 of Thessaloniki and 2 of Athens, apart from their merging, which is a different ball game altogether. How difficult is it for the hospital staff, legally speaking, to belong to the IPEs, the health districts, to allow the system to make different arrangements? Alongside the proposal by Diagnostics, and that is operational all over the world, in that it's not the hospital as a unit, but it's a trust. It's hospitals that complement one another. Mr. Gkikas, well, just a couple of things, and I think that the Minister agrees with me. One of them is to enhance digitization. We need more platforms and AI. This is the only way we'll be able to measure things. And the second bit has to do with culture. This culture will need to exist in hospitals. And the second part has to do with sustainability. We need to ensure that these units are sustainable and productive. To make this happen, we need collaboration between the private and public sector to have results. Mr. Souliotis? Now, I will start where you picked off. It's indicators, KPIs. When you have an administration, you had set some targets. So we have a hospital in this area, we have this percentage of the population that chooses other areas and regions to cover their needs, and we want to keep it within the region. But if we come to think about human nature, it takes incentives. A doctor with many operations cannot be remunerated and paid the same as someone with fewer operations. This is what dooms the system to inertia. Most health centers in the country, the first thing they do when a case arrives there is to refer it to a hospital. So what they will do is they will not go to the health center, they will just go to the hospital because they know that the chances of them ending up there are increased. So we want a system of remuneration of the entire team that works within the hospital under public supervision and responsibility that will be dynamic, that will give the hospital the incentive to keep their population within their place of reference. Otherwise, we have hospitals who benefit because they do not deliver, but they receive the funding at 55 or 60%, and others have an exceeding number of hospitalizations, an increased risk for infections, and doctors in burnout. There is no thoracic surgery clinic with 3 surgeries per month, cardiac surgery. They will forget what they knew or what they did, so we need to restructure these things to follow the course of things. And these 3 hospitals are a first-class opportunity for us to build a model and to say that we want all hospitals to work this way. I understand the difficulty of the endeavor, and we will see that these 3 standards or these 3 models will work, and we have a flagrant example of a hospital that has lack infrastructure to build it, and to say that this is the staffing on the basis of the beds and everything else. These are the remunerations, the pay. Tell us if you want to stay in the traditional model with increasing wages and hirings. Would we solve the problems if we had another 5,000 doctors who received something more? No, we'd still have distortions. So we need to start measuring everything we do so as to avoid such problems. We have a first-class opportunity with these model hospitals. We shouldn't overcome the architectural innovations. The Onassis was a model because it had this pyramid-shaped building, which has added bonuses. We have the hospital beds with natural light, etc. That will be the point of reference for the next 30 or 40 years. It's much more difficult to renovate a hospital rather than build a new one, okay? But we need to see the launching of these new hospital structures in the hospital map. I don't want for any hospital to close, but we may have problems with short hospitalization units. It's not bad to close them down. No one will lose their job. Okay, I would like to say that you said that hospitals need roles. Not all hospitals all hospitals are not the same. They shouldn't do the same work, they shouldn't do the same job. Depending on their position in the system, they need to have their roles, and further down to have doctors and have their role to build a new system. Minister.
Last remark having to do with Stavros Niarchos Foundation. I was waiting for the end, actually. I would like to thank the Greek state. The donation by the foundation, and I'm not talking only about the millions or the airplanes or the hospitals, is of great importance because it gives a new direction to the health system. Because if you take a look at the donations, this is exactly the conclusion that you will draw. The thousands of professionals that have been trained thanks to the donation in order for training programs to be offered is another important offer that we need to acknowledge. And I would like to thank the Foundation for everything that it has done. Thank you very much. Mr. Papoulias, Mr. Boletis, Mr. Gkikas, Mr. Souliotis, Mr. Themistocleous, thank you all very much. We'd like to thank once again the AmCham. Thank you very much. All the best to all of you.